A Nova Scotia mayor says her community is facing an epidemic in the form of an increased risk of Lyme disease. She's calling on Ottawa to act, even after it announced $4 million to fight the disease last week. This time of year, we're seeing an increase in ticks and tick bites across the country. In New Brunswick, officials say they're expecting to see an increase in Lyme disease cases, with the province's new Lyme disease strategy expected to raise public awareness about the infectious disease and bring up case numbers that have been called vastly unreported in the past. We brought in Dr. Danielle Martin to give us some insight and how to protect yourself, to answer some questions from you as well. So thanks for joining us. Let's begin with the first question. We're talking about an increase. Why?
Well, it's hard to know sometimes with this increase whether we're seeing an actual increase in the number of cases or whether we're just doing a better job of identifying cases and picking them up. We are definitely seeing a shift in the geographic locations where Lyme disease is found, and that's because the disease is carried by ticks that attach themselves to birds. So as bird migration patterns shift, we see the ticks being delivered to various places where we weren't seeing them before.
Okay, so we've talked about deer ticks too. So is it deer ticks or bird ticks or how?
Right, so these are tiny ticks that attach themselves to infected animals, often rodents, could be deer, birds, and then they get carried by birds to various other places, and then having fed from those infected animals, they can then transmit the disease to humans. So it's important for people to understand that not every tick carries Lyme disease, and not every tick bite means that you're going to get Lyme disease. The issue is, has that tick previously fed on an infected animal, and that's how the transmission occurs.
A lot of the concern around this has been the difficulty in diagnosis, has been I have headaches, I have stomach problems, I have whatever, and it takes forever to diagnose it. Now, let's talk about that. Why is it difficult to diagnose?
Well, it is a difficult disease to diagnose because the symptoms are so vague and can be attributed to so many things. And so, fever, joint pains, headaches, these are things that, of course, can be caused by any number of diseases, not just Lyme disease. Lyme disease is by far easiest to pick up when it's diagnosed early. There is a classic rash that people can get around the area where the tick has bitten them.
This is really talking about the bullseye rash.
The bullseye, exactly, classically called the bullseye rash.
Because it's a big round red.
Migrans. It's a big round rash that appears around the area where the tick has bitten, usually a number of days after. Starts five to 7 days after, and then grows over time. And so that's much easier to identify. And certainly, if people observe that they are having a rash in a single location on their body that they don't have an explanation for, they should definitely seek medical attention. Okay,
so those are the basics. We've been hearing from viewers as well. So we're going to look at some of the questions and we've got one from Toshia Fleischiker, and I'm just going to read it for folks. I get a tick bite, or rather, I got a tick bite yesterday. I found it on the back of my leg after golfing. I put the tick in a plastic bag. The bite area has some redness and itching. What should I do?
Right, good. So this is a classic story, right? Golfing, hunting, camping, hiking in the woods. These are the kinds of activities that will predispose people to tick bites. The first thing that people should know is prevention is paramount. And the easiest way to prevent yourself from getting Lyme disease is to cover up when you're going out in the woods. So that's the first thing. If you have been bitten by a tick, and you can extract the tick whole with a pair of tweezers by pulling it directly out of the skin, you can seal it up in a bag and you can actually send it for analysis. So if this person still has the tick, that's an option, and it's actually an important way that the Public Health Agency of Canada manages to monitor the migration patterns and the ways in where are we seeing this infection across the country is by a surveillance process where they actually do an analysis of the ticks. The classic rash that people get from Lyme disease comes later, not usually in the first 24 to 48 hours.
And that's the shot of that bullseye.
That's the shot of the classic rash. It can look, a variety of different ways, but that's the classic one. And so usually a rash in the first 24 to 48 hours is not an indication of Lyme. It's more irritation from having been bitten. Having said that, if you know you've been bitten by a tick and you're not feeling well, you should seek medical attention.
Okay. The covering up aspect, I think, intimidates people. It's summer. We've spent 7 months covered up. How extensive does that covering have to be, and what areas should we be covered up?
We're not talking head to toe, right? I mean, the most important thing is your sort of ankles and legs, right?
So sandals are out.
Yeah, I mean, sandals, if you're going hiking in the woods, probably not the most, flip-flops for hiking are not really safe anyway, right? So we should be wearing good
kinds
footwear.
you strap on are pretty sturdy.
So that's, that is a risk. And I think the other thing is that people should be aware if they're in an area where Lyme is endemic. So the Public Health Agency of Canada and Health Canada actually have great information on the web about the geographic distribution of Lyme. So it depends. The short answer is it depends on where you are, if the risk is significant, and then you're going to take your chances and make your choices as we all do in life. But if you know that you're in an area where there's Lyme disease and it's spring or summertime, which is prime time for Lyme, and there are cases being diagnosed, probably a good idea to cover up your ankles. Okay, we got lots of viewer questions, so we want to keep going on with those. So Lucy Gagnier of Ottawa writes, there are various types of vaccines available against ticks in animals, but no vaccine available for humans. Why? And does this have any effect on Lyme disease, even if there were? Right, so there is no effective vaccine for Lyme disease. And it's important to differentiate between trying to reduce tick bites in animals or anyone versus a vaccine against the disease which ticks happen to carry. So Lyme disease, it doesn't come from the tick itself, it's being transferred from another animal carrying the disease to the human. The tick is just the vector. It's the mechanism for transferring it. And until now, present day, we do not have an effective vaccine against Lyme disease, which is why the most important way that we can prevent people from getting infected is to prevent them from getting bitten by a tick. What is Canada doing to improve prevention of Lyme, controlling the tick population, vaccine, quicker diagnosis, and treatment? So actually, Canada's just last week, the federal government announced an entire Lyme disease strategy, which I think is appropriate, and it involves all those aspects. So everything from research to try to look at, is there a possibility, for instance, of developing a vaccine, all the way through to how do we control the tick population? How do we monitor? So surveillance is very important to understand how the population of Lyme-carrying ticks is shifting across the country. Where can we expect to see Lyme? Because that's where we need to then do more public education, both for citizens and for healthcare providers, and then all the way through to treatment. So I think we're gonna see increasing. We are already seeing increasing amounts of conversation about this, and as that disease strategy rolls out, we'll see more. Yeah, everybody seems to be talking about it this year. So Beth Ann has a question for us as well. What to look out for about tick size, color, and anatomy? So basically, how do you identify one of these potentially Lyme-carrying ticks? So the first thing is that ticks are small. They're much smaller, I think, than most people realize. And sometimes when we see them on the, on the B-roll there, they look like sort of the size of a cockroach or something. But actually, they're teeny tiny. And at the stage where they're carrying Lyme and biting, they are often quite small, like the size of a poppy seed, or maybe up to the size of a sesame seed. So you may not even realize that it's a tick. You might just look down at your skin and realize that you got a little bite of some kind, and you can see a little black dot. The use of a magnifying glass actually is not a bad way to try to determine what that little black dot is. The second thing is, although there are some anatomic differences between the kinds of ticks that carry Lyme and the ones that don't, I don't actually recommend this is something that you do at home. If you've got a tick in your skin, pull it out with a pair of tweezers, put it in a bag or a sealed container, and bring it in for analysis. Okay, lots more questions to get to. This is from Edward and Jane O'Rourke. Will bug spray, like Off, brand name there, protect you from tick bites? So actually, yes, it will. The CBC website recommends that people use a product that contains at least 20% DEET. So I don't know what that, the percent is in that particular brand, but, that's a pretty intense concentration of DEET, actually. And there are also treatments that you can use on clothing. So if you're going for serious hikes in the woods, for example, permethrin-treated clothes can be purchased that are pre-treated, and that's an effective way, in addition to covering up, to prevent getting bitten by a tick that can carry Lyme. Okay, Bilal Mohibullah, is bee venom therapy for the treatment of Lyme disease a hoax? Well, I don't use the word hoax, but I'm not aware of any scientific evidence to support the use of bee venom therapy. Okay. So I wouldn't recommend it. Okay, take your magnifying glass, but not your bee venom into the woods. Okay, so Bill Hand, if you've been bitten by a tick,
What do you apply to the area of the body? Is there something topical you could put on?
So there's nothing topical you can put on that will prevent the transmission of Lyme. So if you believe that you have been bitten by a tick and the skin is irritated or itchy, I mean, the most important thing is wash with soap and water first immediately after you're bitten. That's just good, infection prevention and control. And if there's irritation locally, you can take an oral antihistamine. But if there's any skin reaction, I wouldn't treat that with something topical. I would seek medical attention because you want to make sure that this isn't the beginning of the development of that classic Lyme disease rash.
I hope you'll be able to provide complete answers as you head into the woods this summer. Dr. Danielle Martin, thanks again.
Thanks for having me.
Cheers. Our pleasure.